Hello and welcome. Today, we're going to unravel a condition that a whole lot of people deal with, but that's still pretty misunderstood: irritable bowel syndrome, or IBS. We're going to look at what it is, what might cause it, and some ways to manage it, all based on our source material for this explainer.
So let's just jump right in with the biggest question of all. What exactly is irritable bowel syndrome? I mean, it's a name we hear all the time, but what's really going on behind the scenes?
And part of the confusion is because it's this weird paradox. It is incredibly common, but for anyone who doesn't have it, it can feel like a complete mystery. So let's try and solve that mystery, shall we? Okay, first things first, we're going to start by getting a really clear definition of what IBS is, and more importantly, we're going to talk about what makes it a functional disorder, which is totally different from other digestive diseases. All right, here's the official definition from our source. Now, I want you to focus on one word here: functional. This is absolutely the key to understanding IBS. It means that even though the symptoms are very, very real, doctors can't see any physical damage or inflammation in the gut. It's not like Crohn's or colitis. The problem isn't with the gut's structure, it's with its function, how it's working.
So what does a functional problem actually feel like? Well, it's a whole spectrum. You've got abdominal pain, cramping, bloating, and then the major issues with bowel habits. For some, the system runs way too fast, and that leads to diarrhea. For others, it's super slow, causing constipation. And then there are people who get a frustrating mix of both. This is actually why doctors have different labels for it, like IBS-D for diarrhea or IBS-C for constipation.
Okay, so if there's no visible damage, what on earth is causing all this trouble? That's the million-dollar question, right? As we're about to see, it's not just one thing. It's more like a tangled web of different factors, all playing off each other. One of the biggest players is something called the gut-brain axis. The best way to think about this is like a two-way superhighway of nerves and chemical signals that are constantly zipping back and forth between your brain and your gut. In IBS, that communication highway gets all messed up. Signals get crossed, messages get misinterpreted, and you get a massive traffic jam that results in pain and all those other symptoms. And that traffic jam directly affects something called gut motility. That's just the fancy term for the rhythm of the muscle contractions that push food along your digestive tract. With IBS, that rhythm is completely out of whack. If the contractions are too fast and chaotic, you get diarrhea. But if they're too slow and sluggish, everything backs up and you get constipation. On top of that gut-brain stuff, there are a bunch of other potential triggers. Things like sensitivities to certain foods can set it off. Stress is a huge one, as it can directly mess with that communication highway we talked about. Sometimes IBS can even start after a bad stomach bug. And there's also the microbiome, that massive community of bacteria in your gut. If that's out of balance, it can cause all sorts of problems. So with this crazy web of causes and all these different symptoms, you're probably wondering, how does a doctor figure out if it's actually IBS? Well, there is a method to the madness. Let's walk through the path to getting a clear diagnosis. Doctors don't just guess. They use a specific set of guidelines called the Rome 4 criteria. It's basically a checklist to find a pattern. They're looking for recurrent abdominal pain, so pain that keeps coming back. And crucially, that pain has to be linked to your bowel movements. Is it better or worse after you go? Does it happen when you start going more often or less? Do things look different? It's a really systematic way to pinpoint the problem. Now, another huge part of diagnosing IBS is actually making sure it's not something else. Because the symptoms can look like other conditions, doctors will usually run some basic tests. They'll check your blood, maybe test for celiac disease, and so on, just to rule out anything more serious and make sure they're on the right track. All right, let's get to the really practical stuff. You've got a diagnosis. Now what? How do you actually manage this day to day? This next section is all about actionable things you can do to get some relief. Our source material lays out this fantastic list of do's and don'ts. Think of it as your personal IBS toolkit. On the do's side, you have proactive things like keeping a food diary to spot your triggers or finding ways to manage stress. And on the don't side, you've got the things to watch out for, like really high-fat foods, artificial sweeteners, or even eating too fast. It's all about finding that balance that works for your body. Now, beyond those general lifestyle tips, the source we're working from also dives into a homeopathic perspective. It frames this as a holistic view, which really just means it's looking at the whole person: mind, body, and lifestyle, not just the gut symptoms in isolation. So let's see what that looks like. So this table highlights some of the remedies mentioned in the article. The central idea in homeopathy is to match a remedy to the person's unique set of symptoms. So it's not just about, say, constipation.
As you can see with Nux vomica, it's also linked to things like irritability or a sedentary lifestyle. Or look at Argentum nitricum. It's noted for diarrhea that's specifically linked to anxiety. The goal is to treat the whole picture, not just one part of it. And this brings us to what is probably the most important slide in this entire explainer. The source itself includes this disclaimer, and we really want to highlight it. Always consult a healthcare professional. That is so, so important. This is all for informational purposes to help you understand the topic. It is absolutely not a substitute for professional medical advice.
So to wrap things up, we're left with this final question to think about. No matter what path someone chooses, how might taking a more holistic view, one that really connects our diet, our stress levels, and our emotions to our digestion, change how we all approach gut health in general? It's a pretty powerful idea to chew on. Thanks for joining us for this explainer.